It should feel the same. Does it? Good. Just a little tightness in the back of the hamstring.
Yeah.
Beautiful. Easy exhale back. Let this roll into me. Good job. Easy exhale. Let that loose. There. Good job. Hey everyone, this is Dr. Jonathan at Kalkstein Chiropractic, your Baltimore area chiropractor, and today we have Becca again.
Hi.
So Becca has been complaining a little bit of like some symptoms down into her butt and down to the hamstring, nothing past that area. And so we are going to rule out spine-related radiculopathy, where it's impinging on a disc on a nerve root, causing some symptoms down. And then most likely, I think it's PIRIFORMIS syndrome, so hopefully I'm right. So we're gonna test and rule that out. So if you would like to face me, I'm just gonna look at her spine first. Always, as a chiropractor, touch your toes if you can without bending your knees. Tuck your chin. And right now, is that any zinging down that leg right now?
No.
Beautiful. Come back up. And no pain coming back up too.
Nope.
Beautiful. Bend towards your right side as far as you can. And I'm looking for how well she globally moves and go this way in that spine. And Becca's really functional. She moves really well. And no pain with that?
Nope.
Bend backwards. Rotate this. Any zingers down this side?
Nope.
Go this way. Any zingers down this side?
Not at all.
Beautiful. So, is it from our small talk that we had before we started shooting, your symptoms really get exacerbated with sometimes movement, like going upstairs, or if you sit too long, kind of combination of the two, which definitely can mimic spinal related, but I still think it's PIRIFORMIS, just because if it was this, I think some of these movements will be provocative. And next we're doing a slump test. So I want you to have a seat for me here, face this way. And generally it's this right leg that's symptomatic when it does flare out. Okay, so I'm gonna test this side first. Your hands are gonna be behind your back. And I'm doing a little slumps test to see if there's some neural tension from the spinal cord down to her periphery, the sciatic nerve. So I'm going to extend this leg. You're going to tuck your chin and then round your body forward. And so is there any pain in the back or down or left leg or right leg?
Just feeling that tightness down the left leg.
Beautiful.
And the left back.
Beautiful. And same thing, tuck your chin. And this shouldn't be, it should feel the same. Does it? Good. Just a little tightness in the back of the hamstring.
Yeah.
Beautiful. So that was more of a disc neural tension that would have really let her up in the back and down the leg, and not just like a stretch that you felt. Correct?
Right.
Cool.
Right.
So let's go face down now. And I'm going to palpate your low back. Let me know if there's any zingers. Good. Nothing too bad?
Nope.
Beautiful. So it was her right leg that's symptomatic. And does that kind of light you up a little bit?
Just a little, yeah.
Yeah. Does that cause any symptoms down into the hamstring a little bit?
Yeah, definitely.
Okay. So I'm right on her piriformis muscle. And I'm already thinking like it's not spinal related. She is pretty tight in her glutes and hip flexors as well in this posterior capsule. So we're gonna treat it like it's piriformis syndrome. So for those of you that don't know what the piriformis muscle is, it's a intermediate deep glute muscle, an external rotator of the hips And the sciatic nerves will run through your spinal cord, terminate here, and then it will spread down the leg as far as the sciatic nerve. And sometimes people say sciatica, which could be spinal or piriformis syndrome. So if it is in fact piriformis syndrome, then most likely that piriformis muscle is compressing that sciatic nerve. So a lot of times that sciatic nerve will go underneath the piriformis muscle or go over, and then like maybe, I think it's like 15% of people will have their like sciatic nerve pierce the actual muscle itself. Clinically though, it's not really relevant to say that if that is being pierced, then you will always have sciatica symptoms. Not true, not really true for that matter, because piriformis syndrome is less often than I think a disc pathology with a radiculopathy. So I think in my opinion and from literature that the piriformis syndrome is probably more like 6% compared to the spinal related radics that we normally see, which is more common. So how this occurs, the etiology of it, could be a numerous of things. People very active like Becca, where she's moving around a lot, and then people from that side of the coin to the other side of the coin where they sit a lot and compress that nerve even more. So we are going to do some flossing techniques with Becca, as well as some pin and stretch for releasing some of that tension and then adjust. So I'll be right back. I'm grab an assistant and we'll continue. Okay guys, we are back and we're about to do that pin and stretch technique, and we have Mike here to help us out.
Hey everybody.
The strongest CA in the office, besides Becca.
She's got me beat.
We're pinning this muscle. Mike is gonna elongate, moving it into space with the leg. And it should be like a love-hate relationship, almost like a good hurt. Right, Becca? Mm-hmm. She's holding it in for you guys because she's a baller like that. She doesn't show any pain. Come back up, Mike. So we're gonna push a little harder to see if you can elicit some.
Bring it.
Oh baby. So you hear that, Mike?
All right.
So pin and then
Going into this one.
scoop that. Yeah. There it is. So applying a little ischemic pressure like this to the tissues, come back up. Can not really loosening up or taking any tissues to break any tissues up, more so just waken some of these muscles up so that when she does fire them, they fire better, and with better function, usually pain subsides with that too. Keep going, push, push, push. There we go, right there. Beautiful. And so we will do that a few times, and then next, flip on your back. And we're gonna teach, thank you Mike, we're gonna teach Becca now nerve flossing. So that sciatic nerve, again, can be not gliding like it should be in through the tissue, so we're gonna help encourage that through manual flossing. So you're gonna hold your knee with your hands there. You're gonna extend your knee up towards your face until you feel that stretch. Once you feel that stretch, bring your toes to your nose, do a gas pedal push, and then bend the knee again. So right now, while Becca's doing that motion, where you are tensioning that nerve when she's raising up, even more dorsiflexion, slacking the nerve with the gas pedal plantar flexion, and then when she bends, slacks it even more. So we're encouraging this nerve to glide through some tissues that very commonly can get stuck between these big muscles back here. And so this is a very good tool that we send our patients home to do these frequently so that when they are symptomatic, then they have something to remedy their symptoms. How does that feel?
It feels good.
Feels good? Like different than just a stretch?
Yeah.
Nice.
I feel like it's loosening up, but like the pain is going away.
Cool.
Like,
Awesome. So, things that Becca can do at home now. And now that you guys have waited this long, we are going to get into the adjusting part that you guys always love. So, I'm going to have you face me this side. And set you up here, legs straight. Pull, and then from this position, we're going to palpate. Okay, so right there. You're gonna feel compression, so big breath in. Easy exhale back. I'll let this roll into me. So, other side, please. And that's locked. So, also, Becca is super mobile. Maybe has this condition, Ehlers-Danlos syndrome, or EDS for short, where the soft tissue component is very elastic. So she has, she could probably show you some of the mobility that she has with her joints. And that's one that's pretty prominent. So with being so flexible and mobile, locking Becca out is a little bit more challenging sometimes. Good right there. So we're gonna straddle so I can get in range a little bit more. And then big breath. Easy exhale. Let that loose. There. Good job. That moved a lot better that side. So on your stomach now. And arms on these handles. So even though this is for piriformis syndrome, I'm always going to adjust areas of the spine or any joints that aren't really moving functionally like they should, because if one area of the body is not working right, then our bodies are really good at compensating and picking up that slack. So right here. Big breath in. Easy exhale. Shoulder base. Sink. Good job. Beautiful. So, come back up, Becca. Feel alright. I still have that reggae song stuck in my head. Bob Marley just been playing all day in the office, so it's ringing around the rosy in my head. So, how do you feel?
I feel great.
Awesome. So, we're gonna go over some of those movement therapies to reinforce these patterns. Do these homeworks daily, and you should be feeling better in no time. So any questions, comment down below, like, subscribe, and we will see you guys next time.
See ya.